Now, this question is for both of you. We know that Omicron is highly transmissible, that it's much more contagious than previous variants like Delta. However, Omicron also tends to produce less severe symptoms and a little bit lower chance of hospitalization among people who get it. So the question is, why is Omicron such a big deal? Why are we so concerned with this big increase in cases of Omicron?
Sure. So I think there's a really wide range of what symptoms look like for different people. So we can make generalizations about how symptoms affect people as a whole, but obviously individual disease is very individualized, right? And it's based on someone's immune response, how much immunity they already have built up against COVID-19. It's a super complex process. So to say that disease is always mild is inaccurate, and there are people that become severely ill, and there are people that die related to this illness. So I think it's really important to think about the context of the risk of people involved and the symptoms as they present. It is true that more people are asymptomatic or don't have any symptoms when they get Omicron. And it is true that oftentimes, and for many people, it represents as pretty mild upper respiratory illness. We are seeing quite a bit less of loss of taste and smell with Omicron compared to other strains, which honestly just makes it even more confusing in the middle of winter during a flu season with all kinds of other stuff going around to try to figure out if what you have is Omicron or is COVID-19 or not. So certainly the symptoms can be variable for different people, but there are many people who are getting very ill from this disease. So I think it's important to kind of put that in the bigger context of the range of responses that any individual can have.
Yeah, and part of this is essentially that a very small percentage of a very, very large number is still a very, very large number. And so, like Dr. Doucette said, early evidence says that the Omicron variant and the disease caused by it is a lot less severe. However, we are also seeing the largest amount of hospitalizations that we've ever had throughout the course of the pandemic. And what that means is that so many people are getting sick that the very small amount of people that are getting severe illness is still more than anything than we've ever seen before. And this has a couple of different implications. The first is our hospital capacity. So our hospitals are already at the tip of their capacity. And what this means is that soon they're going to have to start limiting the amount of care for non-COVID conditions that they can provide. That's all the more further exacerbated by the fact that hospital staff can get COVID-19 and they have to be in isolation as well. And the second and even more concerning thing is we're seeing the largest number of children that are getting sick than any other time before. And to give you a sense of that, about 4,300 kids got sick in St. Louis County in December. And that number's only going to get much higher as school reopens and kids start playing together. And early data out of New York is also showing that pediatric hospitalizations are increasing, which is particularly concerning for the health department. And so to that end, we continue to stress that you need to take every step to protect yourself and protect your children. So please wear a mask, please socially distance, avoid large gatherings, and get vaccinated and boosted as soon as you can.
Yeah, I think I'll add to that, I think it's really important for us to remember that while most people have the ability now to protect themselves against COVID-19 by getting vaccinated, we do still have a portion of our population, and that's those 5 and under, who don't have that option, right? And who are completely unprotected in this new environment. And that is scary, I think, for us at the health department. That is scary for me as a parent of unvaccinated children who, again, just aren't eligible yet to receive that vaccine. So I think it's really important to think of risk right now through the context of those around you who are unvaccinated, and particularly young children. Because bringing young children under the age of 5 who are unvaccinated to large gatherings and just being in environments in which there isn't masking is really a significant risk to those kids. And we're seeing spread in those groups in ways that we haven't before previously in the pandemic.